The Oxfordshire Care Summary is a health information exchange. It allows data that's held in GP systems, in acute hospital systems and community systems to be seen by users at the point of care. The only people who can access the Oxfordshire Care Summary are clinicians, are authorised clinicians. We've asked all of them to contribute to an online survey, and 96% of those who got back to us have reported an increase in patient safety.
The effect that we need to try and achieve with something like the OCS is to reintegrate care. So many of the problems that we see in the health service are related to failures in communication. And if we can get that working better, then undoubtedly we'll all be in a much safer place.
From the patient's point of view, it's about putting something in place which, in many ways, many patients expect us to have in place already. As a result of this, we are able to impact upon the care of patients in a very timely and efficient way.
The traditional notions or boundaries which existed within healthcare are being blurred, and rightly so. The patients that I come across, they don't hope that we have an aspiration that we will be sharing their information from practice to our setting at some point in the future. They expect that we're already doing so, and they're constantly surprised, when we might say that that's not necessarily something that we have had in the past.
For too long, really, and I think it's partly a technological thing, we've been working in silos. Information exists in the hospital and out in primary care, but there hasn't been the ability to join it up, and this is what Oxfordshire Care Summary does. If OCS begins to build a sense that we're all dealing with one medical or clinical database, it changes people's attitudes to how they record information and how they use it.
The Oxfordshire Care Summary actually saves us quite a lot of time because it gives us access to patient information which would otherwise be difficult and time-consuming to obtain. It's important that everyone involved in the patient's management actually shares information about the patient. We all work in teams and we have to hand over to other teams at different times of the day. So we all work together, and of course when we transfer patients to other people's care, we need to also transfer information about their problems, their medical problems and their management. It's the modern way of doing things.
The Oxfordshire Care Summary doesn't store data. It looks into GP systems, it looks into the John Radcliffe systems, it looks into community systems and provides a view, a real-time view. Once we close that down, that data is not stored anywhere in the Oxfordshire Care Summary. I know from my own experience how much information is gathered and very rarely shared with other people, and that causes huge amounts of frustration. It lowers the quality of care and the efficiency of care, and it genuinely threatens patient safety.
The Oxfordshire Care Summary is about individual patient care. Only clinicians with passcodes and who've been trained to understand the governance issues are able to access it. Only clinicians within Oxfordshire can access it after they've had the training, and they can only access it from a limited number of computers. And it is not about amalgamating data to improve services, so it isn't anything remotely connected with care.data. So if I as a GP change a drug, the clinician seeing the patient the next week needs to be quite clear of what's happened. And those sort of things save the patient time, and particularly pleasantly, they make the patient realise that we're all working together as a team. And I think it's almost a cultural move towards a joined-up approach to healthcare.
It's the patient who controls who accesses the data, and the organisations that may hold that data about the patient don't have the right to withhold information.
We had one particular patient who came into the ward with low blood sugars, with quite a significant impact on their functioning. It wasn't just a little bit of a low sugar, it was quite major. And then I go away and look at the Oxfordshire Care Summary records, and I can see how often people are picking up their medication. I can see that this particular patient had picked up 5,000 units of insulin within the past 2 weeks. And that is about, for him, many months' supply of insulin. And what we discovered there was that he was actually giving himself completely inappropriate doses of insulin without realising it. By understanding a little bit more about what's happening in terms of the prescriptions, we were able to identify a major problem with his insulin administration. And what we're able to do is to use the right drug at the right time for the right patient.
As a GP, I have confidence that my patients, if they get ill, or indeed perhaps equally importantly, if they're under the shared care of hospital specialists like the diabetic service, they can be confident that they're going to get the right information available to them when they need it.
The OCS allows me to check a patient's drug history as well as their medical history, so that I've got an up-to-date picture of what medications they're taking, and if they've got things like allergies to medications, which is particularly important. You know, sometimes patients will come in with a copy of their pharmacy record, but it may be 2 or 3 months out of date, or even longer than that. So what we can access on the OCS is bang up to date. So we know if a drug was stopped yesterday, we would know about it. The OCS sharing data between the different services just allows us to treat the patient looking at the whole picture. So we know all the services that are involved with this patient. And if we need to contact other services, we know who's involved. So it just allows us to treat them holistically. So we're taking in all aspects of their care. Before the OCS existed, particularly patients who were referred by health professionals such as paramedics, we would have then had to make phone calls to the GPs at practices requesting GP summaries to be faxed to us. So we're saving time, we're saving phone calls, we're saving paper and being able to treat the patient with a good, clear, accurate history.
You have the most up-to-date information about prescribing practices within the patient's own practice. You may have up-to-date information about choices which have been made about prescribing in response to possibly abnormal blood results, which are enormously beneficial for a patient or for a clinician who's working in an isolated setting, often seeing a patient for the first time, without necessarily having had any of that background information at hand. I think it empowers clinicians because it enables them to make better decisions for their patients at the point of care. And for patients, it empowers them because for the first time in our health economy, we have information share. We have that aspiration that those patients have been expecting, or that belief that patients had that we'd been sharing this information all along is now a reality.
As medical care gets more complicated and the need to try and keep people managed at home gets more important, having access to the right information helps you make the right decisions.
In the future, the information held in your Oxfordshire Care Summary, you may have entered yourself. It may have come from your telehealth monitoring. It may link to your diary so that we know when your outpatient appointments are. So we're hoping that in 5 years' time, the Oxfordshire Care Summary will be the way we share information about everybody across Oxfordshire.
Patients are the centre of all this work, and we can see that having patient access to this care summary would give them the opportunity both to check that the information is accurate, but also to manage their own health and take a more active role. And I think in many ways that's the real game changer, because patients at the moment sort of get the scraps from the table, but if they can be there sharing the meal, if I put it like that, then we've got a different story altogether.
I'm sure there's a really good future for the sharing of accurate information for the patients, because it's going to make a lot of difference to patient care. Nowadays, a lot of patients have quite complex medical problems, and we need to know all the background to their treatment and management.
The future of the OCS, I think, is a really bright future. As many practices as possible, well, all of them, I would suggest, should sign up for the benefit of treating the patient with clear, accurate records and being able to treat them holistically.
I think in the future it will be the platform that allows us to deliver healthcare in a much more integrated manner. The best healthcare is provided by a fully integrated system.
The OCS is making the NHS in Oxfordshire more efficient and more safe.